A new report spotlights some of the federal government's shortcomings when it comes to Indigenous health care, specifically for mothers and newborns. A Health and Human Services Advisory Committee spent 24 months reviewing data and literature, and here's what it found. Maternal mortality among American Indians and Alaska Natives ranges from 2 to 4.5 times the rate for non-Hispanic white women. In some regions, the disparity is even more striking. Indigenous mothers' mortality rate is 7 times higher, and the data showed an estimated 93% of those deaths among Indigenous people are preventable. Now, with Indigenous people making up more than 10% of New Mexico's population, those stats hit our state harder than most. So to understand what's required to turn those numbers around, New Mexico in Focus correspondent Antonia Gonzalez spoke with the chair of that advisory committee and an Indigenous nurse midwife who helped put that report together.
Welcome, Dr. Edward Ellinger, Chair of the Advisory Committee on Infant and Maternal Mortality and co-author of the report. We're also joined by Dr. Janelle Palacios, a nurse and midwife, Chair of the Committee's Health Equity Group, and she's Salish and Kootenai. Thank you both for joining me. And this report is extensive. One thing that stands out is the amount of historical context used to frame the findings. Dr. Ellinger, why is it important to have a firm understanding of the centuries of hardships facing Indigenous people before considering this specific problem?
We know that belonging is an important indicator of health, being part of a community, being welcomed in a community, being appreciated in the community. And we know that for so long, American Indians and Alaska Natives, Indigenous folks in this country have not felt included. In fact, they felt excluded. And that has impacted the policies that we've created in our society and their sense of whether they even belong in this country, even though this was their country to start with. And it has a huge impact on their health. So it determines all of the federal policies, local policies, and it impacts health directly. That's why we really focused on that context, because that's probably the most important thing that has affected American Indian, Alaska Native health over the last 200-300 years in this country.
And Dr. Palacios, anything to add to that about why it's so important to talk about the historical context before addressing certain health issues, especially when it comes to this one?
Yes, of course. We are a country that has a lot of stereotypes. And so for the longest time, someone's personal outcomes, their health outcomes, so for example, someone who went into preterm labor or someone who may have had extra bleeding after delivery, or someone's use of substances or mental health issues were all put on their own shoulders. It was their own burden. It was their own fault. And if we don't have the historical piece, that context to help us understand that systematic policies actually targeted Indigenous peoples of this nation to disenfranchise them from their families, to break down strong cultural practices and beliefs, to replace them with other ones that made them feel less than, then we have a difficult time understanding why there are such issues like mental health or self-medication through substances, or why people experience higher rates of systemic racism in the form of higher rates of incarceration or imprisonment. So it's really, really important for everyone in our nation to really understand our nation's history. I know when I went to school, I did not know very much about Native American history. It was just a few pages in the book, and we learned about Sacagawea and Pocahontas. And our history is so much more than those two figures.
And much of the report is framed around equity, and that includes data collection. And we know not just this issue, but many issues across Indian country and Alaska Natives, there's not a lot of data. So Dr. Palacios, how did blind spots in the data impact your ability to properly look and analyze this issue?
Yeah, it's a great question. I love this question because we typically are an asterisk nation. If you look at state reports or national data, the American Indian Alaska Native population is usually an asterisk. There is not sufficient numbers. We're not counted. We don't matter. And there's a whole issue about how to count us, which is a whole other conversation, because we're talking about, do we count those that are enrolled only? Do we count those that are just receiving Indian Health Services? Do we count those that self-identify? And to that point, we have to understand part of our nation's histories and policy was to systematically to terminate Native people as a people, so that they would no longer have claims to these lands and resources. And this was pointed out in Chief John Marshall of Supreme Court, where he talked about that the future that he saw was that we would be one group of people. There would no longer be Native tribes, that we would all be, there would be no need to settle disputes among Native reservations or Native people. And American Indian Alaska Native people tend to be a population that has intermarried and mixed with a lot of others. So the first step is trying to identify best ideas of how to count Native people so that we can get to that information.
Dr. Palacios, there is a lot of mistrust still in tribal communities across the country. So how important is it to have these meetings and hear from different Indigenous communities to start building that trust?
Right. So the fact that the committee actually had an in-person meeting on tribal lands was just demonstrating that your community matters, right? That we are here. And the HRSA, Maternal Child Health Bureau, they moved mountains in order to make this happen. You know, the first time in 30 plus years that a meeting was outside of Rockville, Maryland. So they really worked for a good amount of time, I think close to a year, to make this happen. And when we were in the committee and we had people testify and give their testimonial of like their experiences, in addition to the data that they were presenting, we heard that they recognize the importance of having space to share their stories. So we have communities that are accustomed to, unfortunately, a style of presence that is just very short term, a short span of time. And it takes that continued engagement, that continued presence and participation in the community for communities to feel safe, that they can trust you. So this is a first step. It's a great first step, but then action needs to follow this. You know, not just listening to voices, but then taking action, because our communities know what's needed.
Let me add to that. The fact that Janelle was on the committee as an Indigenous person, that allowed people to feel a little safer. And also by the fact that Deb Haaland is a federal appointee from the American Indian Alaska Native community at the federal level. They're starting to say, maybe we're being heard. Maybe we can put a toe in the water and be a little bit more trusting, you know, always cautious, but it's a gradual process. It's not going to change overnight, but just having representation. That's why one of the things, the whole area of the recommendations are, we need more Indigenous people on committees, in task forces, on workforces, in the workforce in general, so that they feel included, they get a sense of belonging and feel part of the community, and that helps build that trust that we're looking for.
And also, Dr. Palacios, you also had a personal side to this report. You talked about your own childhood experiences and patterns. How does that cycle of abuse and trauma impact health outcomes for Indigenous mothers and infants? Can you share a little bit about that?
Sure. At a young age, I experienced growing up as the firstborn of a teen mother, and she herself, my mother, was a child of a teen mother. So we have generations of like teen parents in our families, but we also lived on a reservation. We lived on the Flathead Indian Reservation. We lived in HUD housing. We ate commodity foods. I remember going once a month to go get commodity food. So I remember poverty. I also remember racism, because my reservation has a heavily non-Native people population that own land in most of the towns, and we have an agricultural space. So growing up at the intersection of poverty, of racism, of being Native American and a woman, and having this historical piece of generations of teen mothers, and experiencing firsthand violence, abuse, just different things that come with this historical trauma. As a teenager, I saw my friends also experiencing these similar effects of historical trauma. And at a very young age, I realized that I wanted to do something different, and I wanted to become a midwife and help people and help families. So as I was talking earlier, that the way that many people in our nation historically have looked at, let's say, teen mothers in general, that it's their own fault for becoming pregnant and having a child, as if they were pursuing that. It really takes out that consideration and understanding of there are limited opportunities sometimes for people, that not everyone has the same opportunity because of their launch in life. Then you'll have a better understanding of their health outcomes, their behaviors and practices. And I was able to bring this onto a national level, which I'm very honored to have been able to do that for. So if we're able to understand as a nation and look at our own history, our nation's history, we're able to better help all families in our nation to be more of a community.
So how do we talk about these things without promoting stereotypes or expressing stereotypes?
Something that Dr. Ellinger and I and Dr. Magda Peck have really tried to work at is changing the narrative. So if you have to understand that historical piece and you have to let people share their experiences, and then with awareness of people's experiences, that we can reintroduce new stories so that we can combat those stereotypes. So that's one way that we're trying to really battle against these stereotypes. Another one is that hard data that a lot of scientists and a lot of policies are made from. So we have numbers, but we also have the stories behind that. And the two combined could be very powerful.
And Dr. Ellinger, anything to add? And then also just next steps now after the report, what's the action going to look like?
In terms of next steps, I don't want to leave this conversation without bringing up the whole inadequacies of the Indian Health Service that we heard over and over again. Yes, medical care is not the only thing that's really important. It's the community and living conditions, but we can't forget about the clinical care. And we heard over and over and over again in the stories that we heard that the Indian Health Service, for a whole multitude of reasons, is not meeting the needs of the American Indian Alaska Native community. And so we really need to double down on why is that happening and what can change to make the Indian Health Service or some other system meet the clinical needs, the medical care needs of the American Indian Alaska Native community. That's where a lot of our steps need to go. Change the narrative, collect our data, change our data collection, and improve the Indian Health Service. That would really be the trifecta for me.